Good morning, Facebook. It is Bill, the knee pain guru here, and we're going to talk today. I got contacted by a friend of mine, Jen Mulvaney, from Louisville, Kentucky, who had a question. She actually has a situation that's going on with her knee, and I told her that this morning I would basically answer her questions and map out a strategy as to describing what's going on with her knee and then figuring out what she can do moving forward based on the information that she provided for me. So hopefully Jen will be here on the call. Let's see if I'm able to, let's see, Jen. Okay, so I invited Jen. I'm still working on this whole live thing, all the craziness that's going on. Anyhow, so we're going to get into talking about knee pain with a twisted knee and go from there. So let me bring up Jen's situation here. So she emailed me this morning. She said, I'm writing you to ask for your advice since you are the knee pain guru and all. Running in a field near my house a few months ago and fell in a hole. Twisted my left knee up pretty bad. Kind of gimped around for a bit, but then got back to my normal yoga practice, Pilates, and a bit of elliptical training. Unfortunately, it hasn't seemed to ever completely heal. I still take it is still very tight, and I have to take extra time to stretch it slowly and relax the joint before practice. It feels like it's all the muscles that attach to the kneecap on the outer side that are compromised. Anyway, like I said, I've been able to do my usual stuff with a few tweaks, but I joined the Y and this week went to cardio weightlifting class, which was super fun, but afterwards I was crazy sore and my knee was really giving me a lot of pain in the morning. I definitely want to continue with the class, and with all of my other fitness endeavors, I'm unsure how to move forward. I know you aren't in the area anymore. This is in Louisville, Kentucky. I used to live there for a lot of years. I just thought I would ask you, and I know it's very difficult for you to tell me much without examining it. Just a shot in the dark, I guess. I have insurance and can go to the doctor, but I feel like they would just give me pain medication or something that's not really going to help me heal. Suggestions welcome, deeply appreciated. She also followed up with, she's been using arnica orally and topically and has been definitely giving me some relief when the pain is bad. So, okay. Here is the strategy. So you got a situation with knee pain. Twisted knee, the knee hurts. Taking arnica, you're getting into this pattern where the more you exercise it, the more you move the joint, it's achy and sore afterwards. What is actually happening is the body is stuck in what I would refer to as a pain tension loop. The body experiences pain, it tenses up to protect itself. That tension reduces the space in the joint. The reduction of space irritates the nerves, causing more pain. So the more pain you feel, the tighter the joint gets, the more pain you feel. When that happens, it's very difficult. Like, the neurology of the body is stuck in this place that it doesn't know how to get out of. And the key to interrupting that pattern is what I would refer to as a pain pattern interrupt. Now, a pain pattern interrupt gets a tiny little bit of space around the nerve that's being irritated. When we create that space, there's relief in the joint. We've created a little space in the joint. It's comfortable. The more comfortable the joint is, the more space that's created. So it reverses the process of the pain tension loop by creating pain pattern interrupts on a consistent and a regular basis. So Jen, what's going on in your knee and in your body is when you fell, your body got scared. Natural, normal response to an injury. What happens is it's stuck in this pattern, and this happens with the knee and with any other joint for that matter. So if you're watching this replay or you're watching the video and your neck is sore, your back is sore, your hips are sore, elbow, whatever joint it is, this same type of pattern is displayed in the body because it's protecting itself from a perceived threat. Now, the part that I want to convey to you, Jen, is what we don't know is if something is torn in the knee or not. Now, I'm not here to be the bearer of bad news, but you had said you have insurance and you can go to the doctor. Now, I agree with you that you will probably go to the doctor and they will probably point you towards some sort of pain medication that wouldn't necessarily help you out. But what the doctor does bring to the table is a diagnosis. And the diagnosis is what I need to know if I can help you or not. Now, the diagnosis will let us know if something is broken or torn, that we need, the body can heal itself, but we got to make that a priority before we get into anything else. If there's nothing broken or torn, then the only thing we're dealing with is the irritation of the nerves. And when the nerves are irritated, that's what's causing the pain. And probably the only reason that you sent me an email this morning was because you have pain. For that matter, for anyone else, the only reason that I have a conversation with anyone is because they have pain. They don't care about their diagnosis. So if we can get clear from a medical perspective that nothing is broken or torn, then we can address what's going on. Now, the interesting piece, even though I'm no longer in Louisville anymore, I really don't see anyone in person. I work with everyone remotely. And in doing so, what happens is I can teach you how to create those pain pattern interrupts in your knee or wherever else in your body that you're experiencing pain, and that interrupts, gets the pressure off of the nerves, creates comfort, and essentially moves your body into a what is known from a medical perspective as a parasympathetic state or a rested and relaxed state. And that's where the body recovers faster. When the body's in pain, it's tensing up. It doesn't know how to relax, and it doesn't know how to recover. It does, it just forgets because it's afraid. Anyhow, so the arnica is great that you're putting it on topically as well as taking it orally. That's fantastic. Here's a little tip that will make the arnica go a little bit further. If you take 3 of the pellets and put it in a water bottle and shake that water bottle up, it will make that entire water bottle arnica. And then every time you sip on that, that will help address the pain, the inflammation, the discomfort that's going on in the knee. So that's definitely good, and I would do that in the interim until you're able to get to a doctor, get the knee checked out, the knee diagnosed. Ideally, what would be best would be having an MRI, because the MRI is going to let us know specifically if something is broken or torn in the knee. I have some videos on my YouTube channel that go over the series of the importance of getting a diagnosis, then about choosing the best doctor for looking at your knee, as well as what to do on the other side of the diagnosis. One, if something is broken or torn. On the other side, if nothing is broken or torn. 2 different strategies, however, you understand how to move forward. If you have any questions, please type them in below. I'm happy to answer questions if you're dealing with knee pain. I saw Brandy in Italy was on the thing. I know she's dealing with a lot as far as her knee goes. I know Jen, I could see Jen is on the line here. And there's some other people. Lori, how you doing there? I know judo people tend to have lots of knee pain. Mindy, hello. Nikki, hi there. Jeremy, Melissa, Brandy Chow from Italy. Nice. Did you ever find a doctor to help you with your knee? So let me see. Okay. I can't see comments, I guess, unless someone types them in. So I'll hang out here Jen, hopefully that answers your questions. Oh, Brandy, it started physio and they're only doing electric stim right now. What is the purpose? Electric stim is a way of the pain pattern, the pain tension loop that I was talking about. There is, you know, the nervous system is ultimately affected. So there's a neurological pattern that's going on in the body, and the idea with electric stim is it's causing another impulse, an electrical impulse into the knee to hopefully change that pattern. I believe it can help. However, we need to look at what's going on a deeper level. Understand your the knee pain on a deeper level, so you know how to get yourself out of pain. Okay, it said you need ACL surgery, but need to get prehab before surgery. So was it a complete or partial tear of the ACL? That's 2 questions. The next is, if they are going to do ACL surgery, are they going to use a patella, a hamstring, or a cadaver replacement? Those are all great questions to ask, because all of them have 3 different types of rehab benefits and challenges from where they're taking the graft from. So for those that aren't familiar with ACL surgery, if there's a ligament tear, and the ligaments hold the bones together in the leg, and if the ligament is torn, they can use a tendon from the patella or the kneecap. They can use a hamstring, which is behind your leg in the upper part of the leg, or they could use a cadaver. So, you know, when you check on your driver's license and say, if I die in an accident, send my parts. I'll donate my parts to someone who's suffering. It may go to Brandy to repair her knee. So it all depends on where you're getting the source of the replacement ligament from. Okay, Brandy says it's in Italian. I don't know yet. I will ask these questions next. Okay, the most of your diagnoses is in most of the diagnoses are in Latin. So I don't know. It may not be in Italian. However, if it's in Latin, I don't know if that's going to help you that much more, but you're going to have more of a consistency, because you can take a diagnosis from an Italian doctor in Italy and then show it to an American doctor, and they're all going to understand how to read Latin. Read Latin. The physio said I cannot bend the knee until I learn to straighten my leg after being in a cast for 1 month from the fracture. Okay, it's a see more here. Let me see if I can see that. Ew, cadaver. However, I heard that is the best for someone older. I don't know how old you are, Brandy. However, the benefit of a cadaver ligament is that the recovery is faster, because you're not having damage from another area, from like the patella or the hamstring to recover from. However, there's also a greater chance of the body rejecting the cadaver because it's not coming from your body. The therapeutic use of the peace corner. Okay, Lloyd. The deal with the peace corner is it moves the body into a parasympathetic state. When the body's in a parasympathetic state, it's able to recover faster. So that's the whole concept of my program. You could think of my program as a giant, huge peace corner for snowflakes. And that by moving the body into a parasympathetic state, by getting the pressure off of the nerves, it facilitates the healing of the body faster. Peace corner in Latin. I don't know. Do a Google Translate on that and let me know. Why do I keep laughing? Is because I don't take my job terribly serious. I find the options that the medical profession offers to be very humorous, because as much as we know, it's surprising how much we don't know. Okay, let me see here. Okay. Getting all these tweets at the same time. Any other questions? Any more questions? There we go. Awesome recovery, clinical. Okay. Let's see. Brandy, yes, we're laughing because of you. Maybe we'll do a Skype video and you can share how you ended up with the knee injury. At least you didn't dislocate your left knee 4 times like I did. Okay. Okay. Brandy asks, okay, next up, my foot now looks like a club foot. What is that about? Club foot in terms of that it's swollen, that it's swollen, or that it's kind of like you can't really control it. So let me know about that. Because if it's swollen, then you're looking at it's swollen. Okay. When the knee is in pain, the hips are directly affected. When the hips are affected, the hips or the pelvis is the pump of the entire lymphatic system. The lymphatic system flushes out your like the garbage, the waste products from your body. And when there's tension in the pelvis, it causes the body to protect. When the knee's in pain, it causes the body to protect the knee. So there's tension that's transferred up into the pelvis. When the pelvis is holding on tension, it's not moving freely, which is the pump of the entire lymphatic system. The only time the lymphatic system works is when we move. So if the body is not moving because you've had to immobilize the leg, you're having pain in the knee, your body is tensing up to protect itself, what ends up happening is the lymphatic system isn't able to move fluidly and flush itself out. So part of the swelling is going to be from the injury in the knee. Another part of the swelling is because you're not able to, Lloyd, you can't call me. You can't call me while I'm doing the live video. It doesn't work that way. I'll talk to you later. So that's part of the reason why the foot is swollen, even though you haven't injured the foot. So, Brandy, does that answer what you got going on? That really is why. Is that the pelvis is holding tension. 5 weeks in bed would do it. Makes sense. Okay, this is family hour. Okay. Anyhow, any other questions? I'm actually doing, this is the first video, I'm actually doing it on my personal Facebook page because when I do it on my Knee Pain Guru Facebook page, like 2 people see it. For some reason, they don't want you to promote on your, unless you pay for advertising. So I'm going to start doing these on my the Bill Facebook page. Anyhow, Brandy, after the surgery, you and I are going to have to work because you got a lot of stuff going on, and I can get that, help you out and get the body healing a lot faster. Jen, if you have any more questions, let me know, because this was actually your video. This was the reason why I was doing the video. And anyone, if you see the replay of this, ask your questions below. I'll see those and I'll be able to comment on those or do other live streams. For those that are watching the replay of this, you can check out my website, thekneepainguru.com. You can go to my YouTube channel. YouTube, just Google, or in YouTube, search The Knee Pain Guru. I'm up there. I'm on Twitter. Well, I'm here on Facebook. You can see that. Okay. Hillaway, hey Bill, I got some serious swelling on my upper knee and feel pain in my lower quads too. This is from tennis. Is that a question or is that a statement? Or should we phrase your answer in the form of a question until Brandy gets hijacked? You know what, Brandy? You know what you should do is you should fly me over to Italy, and I'll work with you in person. That would be the ideal way to go. Any advice on exercises or things to look out for? Well, first of all, go to the Hillaway. Here's the thing on exercise when you have knee pain, and this goes for most any type of pain. There's the whole mentality of pushing through the pain. No pain, no gain, just do it. Pain is weakness leaving the body. When the body is in pain before you start exercising, let's say you have knee pain, and you push through that pain, you already have a neurological dysfunction in the body. The body is protecting itself from the injury. When you push the body in that space, what ends up happening is you create a further neurological dysfunction. So the body's already compensating and you're trying to exercise more. It's more prone to injury in that space when you're exercising starting out in pain. So pushing through the pain when you're starting out in pain is not the way to do it. That's why there's so many people limping around. The key is, now that's not to say every time you feel pain, you back off. If you start out and exercise and you have that resistance, you got the little voice inside your head that's saying, I don't want to do this. That's the type of resistance that you push through, and that makes the body stronger, makes the body better. But if you're starting out in pain, especially in a joint, that's not what you want to do, is push through that place. Incorporate pain pattern interrupts, which is getting the pressure off of the nerves, get the joint comfortable. And when you get the joint comfortable, then the body relaxes, and then you can start your exercise. But if you want to do that first before you start pushing. Okay. Any more questions? Oh, so Hillaway, my advice, I would go back to what I had suggested to Jen at the beginning, which was get your knee checked out, make sure there's nothing broken or torn in the knee, and then come back and let me know what it is, what the results the doctor gave you, the diagnosis that they gave you. Because if there's something broken or torn, we have a different strategy than if nothing's broken or torn. It's the same conversation I had with Brandy, and the same thing that I presented to Jen at the beginning. The doctors do serve a purpose, but we have to be clear on what that purpose is to make sure that we know how to get the help from them. When we rely on doctors for everything, and their ability to help is limited in scope. So we want to understand what they're really good at and go to them for that thing, which is a diagnosis, which is to understand if something is broken or torn. Once we find that out, then we can pursue our own healing from that place. Okay. Okay, Hillaway says, that's why I'm limping around. Thanks. We'll let you know what the results are from your fellow Ashevillean. Okay. Yeah. Okay. Oh, hey, Anna. My right knee hit the ice last year hard, swelled up, flared and plantar fasciitis. Let's see. Flared up plantar fasciitis. Never had x-rays for the knee, but they gave me a shot for the plantars. A year later, my knee is weak and I can still get on my treadmill. Should I have this looked at? Yeah. And the reason to get it looked at is to rule out that something is broken or torn. And that's the big piece. Odds are, if it's been a year, whatever was broken or torn could potentially be healed, but we want to know exactly what we're dealing with. Think of it like you can't straighten up the living room until you turn on the lights. So we got to turn on the lights by getting the diagnosis to know what we're dealing with. And then once we know that, then the strategy is clear. If something is broken or torn, then we're going to look heavily on a nutritional component, supplementation component to get the body to heal itself faster, so we're not doing things to aggravate the tear more. Sometimes surgery may be in order, depending on the situation, but we want to be clear what we're dealing with. And then if nothing is broken or torn, then the only thing we're dealing with is the irritation of the nerves. And the irritation of the nerves is a very different, we start separating why we're experiencing pain. If the pain is from a tear, different animal. If the pain is from just nerves being irritated, different animal. So we get clear on that, and then we know how to move forward. And the cool part about it is, once we set up the right conditions for the body to heal, it heals really fast. It gets out of pain really fast. We just need to know what we're dealing with. So that is it. Okay. How's that? Are these we answering the questions? Lloyd. Man. Okay, dude. Okay. Well, you know how to find me. kneepainguru.com. On Facebook, on YouTube, on Twitter, on my website. So you can check that out. You can hit me up on my Facebook page. Brandy, you're welcome. Thanks to everyone who asked questions. If you do have any other questions, just shoot an email over to me or go to my Knee Pain Guru Facebook page. Ask me a question there. I get those and I'll answer them on live feeds like this. The big thing is to know that, you know, it's not help. You know, there's things you can do. We just need to understand the body a little bit different. Share this video with your friends on your friends' Facebook pages. Anybody you know that's limping, they're the person that you share with. Help the people that are limping, because they tend to be cranky when they're limping, right, Brandy? Hopefully this video will make them laugh a little bit and give them a direction to get them out of pain and help them. So, okay, this is Bill, the Knee Pain Guru, going to sign off for now. Have a wonderful rest of the day. Make it a good one.